does that mean that you are into some form of price controls and regulation of prices?
I think that oversight means that not setting prices necessarily. But in the Medicare system, as I understand it, we have that. We do have that. Could Congress pass laws? I think we either have to go Medicare for all and do it across the board. I don't think it could be done individually in states. But I do believe that if we had congressional oversight with real hearings and investigation and action, I give Josh Shapiro a lot of credit. Josh is doing a great job as our Attorney General. He's tackling this issue. And Josh and I ran against each other. We talk often, and I've commended him on what he's doing, not only in the opiate problem, but in this particular issue he is looking at. And if all the Attorney Generals would do that in the individual states, I think we would have something done. Price controls, it didn't work when Nixon tried them. You know, Nixon tried price controls in the 70s. That's how old I am, so I remember this stuff. But, you know, I think that that's a problem. But in a Medicare system, the docs operate fine with their Medicare. I mean, they understand, you know, what, but $40,000 for 25 minutes on someone who wasn't going to make it, I mean, you see a lot of that.
We absolutely have to get away from employer-based insurance. It's bad for employers and small businesses, and it's terrible for employees. It's terrible for our employment situation, because what happens is, I will tell you, I am a small business owner. I'm part owner of the law firm in which I practice, Gross McGinley. And I will tell you that we make decisions about whether to hire people when we need them based on the benefits and the cost of the benefits. So I firmly believe that we have to get away from employer-based insurance.
On the same line, this will be for David. High deductible insurance plans leave citizens hugely vulnerable to medical costs. The current law allows over $7,000 in out-of-pocket expenses in addition to the cost of premiums. Many of our citizens avoid or delay getting care because they cannot afford the cost, even when they're insured. What can be done to change that circumstance? And tied into your earlier comment, if you're not supporting the bill, do you support an alternative bill on how to deal with this problem without some version of single payer?
Okay, because I ran out of time, I didn't get to my point to close on that, but thank you for allowing me to follow up with that. So for the, and I'll get to that as the second part, so just to answer the question, so when it comes to deductibles, well, Medicare for all, you know, rule of parsimony, you know, if we have that, we don't have to worry about these deductibles and having co-pays and everything else, and having these out-of-pocket expenses of $7,000, which is, that's crazy, you know? For the average working class, middle class family, they don't have that, you know, that's, most people just don't have that laying around. Let's be honest. So like, just the fact that that's there, it's, you know. So, I do support Medicare for all, I just do not support this bill, because the bill in the way in which it currently stands is Medicare for most, not Medicare for all. Because if it's Medicare for all, then everyone needs to be included. That's the point that needs to be made about this bill, because in a lot of cases, people are out of distance from their health network in which they are supposed to be living and thriving within, veterans in particular. I myself and my wife, we're both disabled veterans. We have to travel over an hour just to get to either Scranton or to get down to Philly. And I know that there's other articles out there where individuals on reservations have to travel even greater distances. And there's also veterans that live out in the Pacific that have to travel great distances, sometimes having to travel to the States to get to the healthcare network in which they're supposed to use. So, Medicare for all, everyone gets their card, everyone gets access, everyone can just roll into a doctor's office and say, hey, I need help. People should have that right. People should be afforded that right.
introduction that I lived in France, which even in the Fix-It video, they mentioned that that is #1 in the world for healthcare. I lived in that system, and it's a weight off your mind knowing that whatever happens to you, you will be taken care of. You will not go into any type of bankruptcy. You will not have to worry about trying to figure out how we're going to pay the bills and what are we going to do. We need to really take that as an example as what we want to work for, what we want to work towards. Within the question, you talked about how people are delaying care. What happens then is that when they delay care, they get sicker, and that costs even more money. And this is where we need to have Medicare for all, because we can't let people delay their care, buy their prescriptions only when they can. We cannot have the decision made around the kitchen table. Does my kid get chemo, or do we buy groceries this month? So.
So this will be for Susan Wild, and then Greg, if you could also respond. And it relates to drug prices in the United States, which we all acknowledge are out of control. We're generally paying twice as much for medications as the rest of the world, over $1,000 per person just for prescription drugs. And people are not taking the drugs that they need or cutting the pills in half. The taxpayers fund $32 billion in basic research out of the National Institute, mostly out of the National Institutes of Health and Science, for most of these drugs. And yet there are laws on the books that allow the director of the NIH to intercede with a drug company who is profiteering on a particular drug, and we're not seeing any activity. Those laws have never been used for the benefit of the American people. Why are we paying twice as much as the rest of the world when the taxpayers are actually paying for the bulk of the research?
The short answer to that question is, it's about corporate greed and about our government not taking care of its people. Big Pharma has more lobbyists in Congress than almost any other industry except the gun industry. There are 2 pharma lobbyists for every member of Congress, literally. We have to take the profit motive out of the equation when it comes to prescription drugs. How many of you are on Medicare? Okay, so CMS, the Center for, CMMS, Center for Medicare and Medicaid Services, is not permitted to negotiate drug prices. Can you imagine that? And yet, the Veterans Administration, which has the lowest drug prices in the country, is permitted to negotiate drug prices. What is the rationale for that? There is no rationale. We need to move to a system of eliminating, we need to move to a system of eliminating the profit motive from prescription drugs. And we also, in the immediate term, in the very short term, need to start permitting people to import pharmaceuticals from other countries. Now, you hear that quality is a concern, and that's why we're not permitted to import our pharmaceuticals from Canada. Seriously? I mean, it's Canada, first of all. Secondly, how many of you have some sort of imported food product in your pantry right now? So you're allowed to eat imported foods, but you're not allowed to import medications that are vital for your health and life. So, in short, I think that we need to eliminate the profit motive completely. We should not permit pharmaceuticals to be something that are allowed in Congress. And we should, in the very short term, as I said, permit people immediately to import medications that they are able to get on the free market from other countries. Thank you.
We have commodified healthcare. And we have commodified the pharmaceutical industry. And we have placed profits over people. The fact of the matter is that 2,700 lobbyists representing 1,300 companies bought and paid for most members of Congress on both sides of the aisle. So providing congressional oversight, 2/3 of our members of Congress are not only currently fundraising for their seats, but 2/3 of them are receiving money from big pharma and from health insurance companies. We don't have a health insurance system. We have a health insurance industry that hasn't really been about health for the last 30 years. I have never seen a health insurance company change a bedpan, take a vial of blood, take a temperature, and if we think that they're going to stop paying dividends to their shareholders, or the underlying element here is campaign finance reform. Look at the candidates who are running, and look at their federal filings, and look at who are paying for them to be in those seats. Most of those seats are already bought and paid for. $418 million. That beats call time any day of the week. They are learning how to package and use corporate PACs in order to endorse certain pharmaceutical companies. We are the only industrialized nation that allows pharmaceutical industries to advertise to consumers, so that consumers can turn around and say, can you prescribe something like that? That ain't right, that's wrong.